What's up, ladies and gentlemen? Welcome back to NeuroSketch with Dr. Kenny. But if this is the first time you've seen this channel, don't forget to subscribe. Today we're going to discuss about the anterior compartment of the thigh. But before you dive into details of the anterior compartment, let's first have an overview of the compartments. After removing the skin, we see you have something shiny here. This is called the deep fascia of the thigh. The deep fascia of the thigh is called fascia lata. Fascia lata derives its name from Latin etiology. Fascia means fascia, lata means wide. Remember about the latissimus dorsi? We said is the widest mass of the lattice, wide. So this is also called lata, means wide fascia, because it encircles all the muscles of the thigh. Okay, let me remove this muscle and this fascia, and then we see the thigh is made up of three compartments of muscles. The muscles of the thigh are divided into three compartments, and we have the anterior compartment, we have the medial compartment, and then we have posterior compartment. Now, let me give you a simple rule to control the game, and then we're going to modify this rule as we'll be moving, but you can write that down. The anterior compartment of the thigh is supplied by the femoral nerve. The femoral nerve supplies the muscles of anterior compartment of the thigh, and then the medial compartment is supplied by obturator nerve, and then the posterior compartment is supplied by you just like sciatic nerve, supplied by the sciatic nerve. We're going to modify. Today we're not talking about the medial and the posterior compartment, but once we do, all this will make sense, and we're going to modify these rules as well. Okay, so anterior compartment of the thigh, you can also write that down. The anterior compartment of the thigh are described as hip flexors and knee extensors. Hip flexors and knee extensor. You write that down. And what are the muscles of the anterior compartment? But remember, keep in mind that not all these muscles will do hip flexion and the knee extension. No, we have some of the muscles, of course, are going to do both the hip flexion and the knee extension, but most of muscles will have a localized effect. Okay, some only they will only do maybe flexion of the hip, and some of the muscles will do extension of the knee, but only few muscles will do both and knee and hip effect. And the rule is even easy because if the muscle is crossing a joint, it's going to act on that joint. Easy. But if the muscle doesn't cross that joint, then it's hard for it to have effect on that joint. So what do I mean? Let's see the muscles of the anterior compartment. For example, let's start with these muscles that are crossing only the hip joint from anterior compartment, but they are only crossing the hip joint. Okay. This muscle here, but this is sartorius muscle. Okay, let me remove the sartorius muscle. Sartorius muscle is closing both the hip joint and the knee joint, so it has got actions on both hip and knee joint. But I'm starting with hip flexors. These muscles that I'm mentioning right now, they are hip flexors. They are flexing the hip joint. Okay, number one is sartorius. You can draw two tables, or maybe two trees. Like you draw a tree line here, and on this side you write the hip flexors, and on this side you write knee extensors. But all these muscles are anterior compartment. Okay, so the hip flexors, number one, you have seen you have sartorius muscle. Number two, we have this muscle here, which is formed by the union of iliacus muscle and the psoas major. So iliacus muscle and the psoas major together, they are forming a iliopsoas muscle. And the iliopsoas muscle is going to insert to the lesser trochanter. It's going to insert to the lesser trochanter. I'm going to show you later today. And this iliopsoas is the powerful flexor of the thigh. Is the powerful flexor of the thigh at the hip joint. You can write that down. Okay, let me remove this muscle first and show you where it goes. Okay, so this is the iliopsoas, this one, conjoined tendon called iliopsoas, and it's going to insert itself to the lesser trochanter. I can't see the lesser trochanter at this point, but okay, I can't see the lesser trochanter, but let me continue. So muscle number two is the iliopsoas. Let me remove iliopsoas muscle. And where does it insert? It insert to the lesser trochanter. I'm going to show you later today. Lesser trochanter. This one, psoas major. I'm removing it. Okay, that's the lesser trochanter. That's small thing there. That's the lesser trochanter, and it insert there. This is the powerful flexor of the thigh. And if someone got a violent contraction of this muscle, it can peel off the lesser trochanter, and then a piece of bone comes with the tendon, and that fracture is called a Russian fracture. So iliopsoas muscle is associated with aversion fracture of the lesser trochanter in case of violent, strong violent contraction of this muscle. It can take off that piece of bone. Okay, so that's muscle number 2, that is the hip flexor, and we've started with sartorius. Number 2 is hip. Number 2 is this. Number 2 is this iliopsoas. Number 3, this muscle is called pectineus. And the pectineus muscle is coming from the pectineal line of pubis. As you can see, it's originating from the pectineal line of the pubis, and it's going to insert to the pectineal line of the femur. I think you remember the femur. It's going to insert the pectineal line of the femur. I'm going to show you all this attachment, and let me remove this muscle and see. That is the third muscle that is doing a flexion of the hip. The next muscle from the anterior compartment that is doing flexion of the hip is this muscle here, which is called the rectus femoris. Rectus femoris. The rectus femoris, of course, is a part of quadriceps femoris, but this is the only part of the quadriceps femoris that crosses the hip joint. This is the only one that crosses the hip joint, and so it has got effect also on the hip joint. So these are the hip flexors. I'm not removing this muscle because I want to show you this quadriceps femoris. Okay, now from anterior compartment, these that I've showed you. These are the hip flexors. Let's go to the knee extensors. What muscles are doing knee extension? But of all these muscles that you have seen, only 2 muscles are crossing both the knee joint, the hip joint, and the knee joint. We have seen sartorius, iliopsoas, and pectineus, and this rectus femoris. But only rectus femoris and sartorius are going to cross the knee joint as well. So let me take back the sartorius muscle. Yes. Okay. Now we are discussing the muscles that are doing knee extension. Number 1, so we have this muscle called quadriceps femoris. Number 1 is made up of quadriceps, means 4, seps, 4 heads of origin. And these muscles are, number 1, you have this rectus femoris, and rectus femoris we have seen it is crossing both the hip joint and the knee joint, so it's also a knee extensor. It is a hip flexor and a knee extensor. I am removing quadriceps femoris, I'm removing rectus femoris, and then I see I have 3 muscles here that are called vastus. The word vast comes from vast. Vast means huge, big, huge, vastus. So we have 3 muscles that are making this, they are making this contour of the thigh. So the thigh is that big because of these vastus muscles. So we have vastus. They are arranged in 3 pattern. We have the vastus lateralis. You see, is a huge muscle that is on the lateral side. Let me remove the vastus lateralis, and then we have vastus medialis, the huge muscle on the medial side. And then below the rectus femoris, we have vastus intermedius. These muscles together, they were making the quadriceps femoris. And the word quadriceps means it has got 4 heads of origin. What are they? You have rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. Together they're forming the quadriceps femoris. Now the quadriceps femoris, and of course we have this muscle of it is called articularis genu muscle, or muscle of the knee joint, articularis genu muscle here. But this is an anatomical variation. Sometimes it's here, sometimes it is not. Okay. Now this the quadriceps femoris, these are extensor of the knee joint. These are extensors of the knee joint. Remember, I was just giving you the general rules. These are the extensor of the knee joint. They are going to form a common tendon, and that common tendon is going to this one. This is a common tendon of quadriceps femoris, and this common tendon is going to insert to the patella bone here, the biggest sesamoid bone, and then after patella they are going to form a ligament which is called patellar ligament. Remember, this is a tendon because a tendon is connecting muscles to a bone, but this here is a ligament because a ligament is connecting bone to a bone. Now the tendon of quadriceps femoris is going to insert the tibial tuberosity, but not directly, indirect by the way of patella, and they're going to insert as patellar ligament. They're going to insert as patellar ligament, and this patellar ligament is what we hit when you are doing the patellar reflex. When you are doing patellar reflex, you are going to hit with the reflex hammer at this tendon here, and then someone will have contraction of the quadriceps femoris, and the effect is the leg will extend. So the quadriceps femoris is extensor of the knee joint. But I think we're going to discuss each muscle in turn, at least, maybe, because okay, the time is moving fast. Let me see what I can do. Okay. So very special is this muscle which is called rectus femoris. The rectus means straight muscle of the thigh. Rectus femoris, straight muscle of the thigh. This is so special of this quadriceps because, first of all, this is the powerful extensor of the knee. And because of that, it is also referred as a kicking muscle. If someone wants to kick a ball, you will first of all do flexion of the extension of the hip and the flexion of the thigh of the knee so as to have that shooting power. So when he's going to kick the ball, he will extend the hip, he will flex the hip and extend the knee to kick the ball. And that movement is executed by the rectus femoris, and this is why rectus femoris is considered as the powerful extensor, and is also considered as the kicking muscle, rectus femoris. What is the nerve supplied to rectus femoris? Of course, we've said the anterior compartment is supplied by the femoral nerve. Okay, so that is rectus femoris. I think that's only information about it. But it's originating. It also has got two heads of origin. Let me move this muscle. Rectus femoris has got two heads of origin, as you can see here. Let me move this muscle as well. Yes, you can see it has got two heads of origin. One head is here and the other head is here. So one head is coming from anterior inferior iliac spine, and the other one is coming somewhere here above. It's coming above the above that socket acetabulum. Okay, that's rectus femoris. I think that's the only information about rectus femoris that you have to know at this point. And next we have these vastus muscles, but they are coming. The vastus muscles, they are not closing. The rectus femoris, I've told you, the only muscle of the quadriceps femoris that crosses both joints. It crosses both the hip joint and the knee joint, and as a result, it has got effect on both joints. But these other muscles, the vastus lateralis, intermedius, and the medialis, they are not crossing the hip joint, so they do not have any effect on the hip joint. They only have effect on the knee joint, and that is extension. Next, let's talk about this muscle. This muscle is called sartorius, written this way. And this muscle is very special because this is the longest muscle in the human body. No muscle in the human body is longer than sartorius, and this is so unique. Sartorius muscle. This muscle is also called Taylor's muscle. Okay, it is originating from the anterior superior iliac spine. This is anterior superior iliac spine, and this is where this muscle takes its origin. It's originating from anterior superior iliac spine, and it's going to insert itself. The distal attachment is going to be on the proximal medial surface of the tibia. But you're going to see later that this insertion is made by three muscles. Three muscles are coming together to form a conjoined tendon, and that tendon is called pes anserinus. Pes anserinus. P-E-S-A-N-S-E-R-I-U-S. Pes anserinus, and that is so unique. The pes anserinus is a goosebump. Is a goose foot. Is a goose foot. Okay, so that's certain the certain class of duck. Okay, so this is sartorius muscle. It's going to join, of course, gracilis and semitendinosus from different compartment, and then we have a mnemonic here that for the muscle that are forming this pesi serinus, this conjoined tendon, we say glory before T. Say glory before T. Say S is for sartorius, G is for gracilis, and then T is for semitendinosus. We're going to discuss them in details while you are doing this medial and posterior compartment, but that's your sartorius. Okay, what is the action of sartorius muscle? Now, the sartorius muscle is acting on both the hip joint and the knee joint. Number one, we said the anterior compartment are flexors of the hip and extensors of the knee, but sartorius muscle is a flexor of both knee and the hip. It flexes both the hip joint and the knee joint, and this is so unique of the muscles of the anterior compartment because they were supposed to extend the knee, but this one is flexing the knee. It's flexing both the hip joint and the knee joint, and that's your sartorius. But that's not the only action that the sartorius muscle will do, because it's coming from the lateral side to insert to the medial side. When this muscle contracts, it will abduct the thigh. So it abducts the thigh at the hip joint, and also because it's coming from the lateral side inserting to the medial side, when this muscle contracts, it will pull in this direction. So what will happen is external rotation or lateral rotation of the thigh at the. Now if we combine these actions together, we see we have flexion of the hip, flexion of the knee, lateral rotation of the hip, and abduction. One more time, we've said if we combine the action of sartorius muscle, what you're going to get is a flexion of the thigh, flexion of the hip, abduction of the thigh, and the lateral rotation of the hip. So these are the movements that are being executed by the sartorius muscle. And because of that, sartorius muscle is also called the honeymoon muscle. Sartorius muscle is also considered as honeymoon muscle, but this is just a nickname, and it's getting this name because of the action of sartorius muscle. What does it do? It does flexion of the thigh, flexion of the knee, abduction of the thigh, and the lateral rotation of the thigh. Together, this movement is suitable, it's conducive for honeymoon activities, and this is considered as honeymoon muscle because if you have action of the right sartorius muscle and the left sartorius muscle, you're going to externally rotate both thighs, abduct both, and then it flex the hip and it flex the knee joint, and that's why it's considered as honeymoon muscle. This is sartorius muscle. What's the nerve supply to sartorius muscle? Of course, we've seen the anterior compartment is supplied by the femoral nerve. Okay, so I'm removing the sartorius muscle. We've talked a lot about sartorius muscle, and let's talk about something else. We're not going to discuss this rectus femoris. We've already seen already, but this vastus lateralis. Okay, we have this muscle here. Some people are confusing. This muscle is called tensor fascia lata. Tensor fascia lata is a muscle. Okay, and what does it do? It tenses the fascia lata. What's the fascia lata? The fascia lata is the deep fascia of the thigh. So this muscle is called tensor fascia lata because it tenses the deep fascia of the thigh. It's a muscle itself, it's a muscle. But this muscle, it is not the muscle of the anterior compartment. Even though when you are doing dissection, you're going to discuss this muscle together with the muscles of the anterior compartment. But this itself is not the muscle of the anterior compartment. This is a muscle of the gluteal region. You can consider it as muscle of gluteal region because even its nerve supply is coming from the inferior gluteal, superior gluteal nerve. The same nerve that supplies the superior, the gluteal medius and the gluteal minimus. This muscle. Okay, but this muscle is going to insert itself to the iliotibial tract. We're going to discuss it. Maybe we discuss it when we are doing the anatomy of the gluteal region. The iliotibial tract. This is a condensation. The iliotibial tract. You can write that down. The iliotibial tract is condensation of the deep fascia of the thigh. It's a condensation of fascia lata, iliotibial tract, and it's learning from. You listen to the word. It's coming from the ilium, iliac crest, to the tibia. So iliotibial tract, this one. And this iliotibial tract serves as point of attachment for two important muscles. Number one, you have tensor fascia lata, but then you have the powerful extensor of the hip joint, which is the gluteus maximus. Gluteus maximus. These are the two muscles that are inserting into the iliotibial tract. Okay, we have seen the powerful flexor already, formed by two muscles. We discussed the psoas muscle in the posterior abdominal wall, and removing the psoas muscle. We discussed about the iliacus muscle, and we've seen where it's going to attach, and the pectineus muscle already. Let me remove these muscles and show you the bony, but we already discussed about the bony, which is the femur, the femur. Okay, so this is the femur. This anterior compartment, vastus muscle, vastus medialis, will attach on the medial line of the on the medial surface of the linea aspera, or the medial lip of the linea aspera. The vastus lateralis will attach on the lateral lip of the linea aspera, and then vastus intermedius is attaching on the anteromedial surface of the femur. So guys, I think we have a wonderful moment discussing all this, and if you've enjoyed this